with parliamentary approval. B, the budgetary expenditure of government agencies as it occurs and keeps Parliament informed of how the budget allocation is being implemented. And C, the administration of government agencies to determine hindrances to their efficiency and to make recommendations to the government for improvement of public administration. The purpose of this meeting is to examine the internal controls, expenditure, and the accessibility and availability of diagnostic imaging services at public health institutions with specific reference to the Tobago Regional Health Authority. The role of the committee is to, 1, assist the stakeholders in achieving the efficient delivery of services while ensuring that expenditure is embarked upon in accordance with parliamentary approval. 2, determine the challenges being faced and possible solutions to these challenges. And 3, make recommendations for improvement of public administration. This meeting is being broadcast live on Parliament's YouTube channel, ParlView, and there will be a delayed broadcast on Parliament's channel 11 and radio 105.5 FM. Viewers and listeners can send their comments related to today's inquiry via email parl101@ttparliament.org, facebook.com/ttparliament, and Twitter @ttparliament. Participants are kindly advised that their microphones should remain muted until recognized by the chair. I therefore now will invite the members of the committee to introduce themselves, and that will be followed by introductions from the Tobago House of Assembly and the Tobago Regional Health Authority. So can I ask the members present here, we maybe can start with the Vice Chair to introduce themselves.
Good afternoon, members of the TRHA. Welcome, thank you for being here. Sorry, Lakram Bodo, Vice Chairman of the PAAC.
Thank you. Well, I see up on my screen, Member Mark.
Yes, Chairman, good afternoon to the members from the Tobago Regional Health Authority, as well as members of the Tobago House of Assembly. I would like to welcome you all, like the Chairman did. My name is Wade Mark, member.
Member Webster Roy, can you now introduce?
Good afternoon to members of the committee. Good afternoon to those from the Division of Health, Wellness and Social Protection and the Tobago Regional Health Authority. I am Ayana Webster Roy, member.
Thank you. I see Member Bacchus. Could you then follow?
Thank you, and good afternoon again to similar members of the Assembly, the Wellness Committee. My name is Hassel Bacchus, member.
Member Rambarat.
Good afternoon, members. My name is Clarence Rambarat, member.
And I think the last one we have here is Member Bathalmi.
Good afternoon. Good afternoon, members and representatives from the TRHA. Yokima Bathalmi, member.
Thank you very much. And then maybe we can invite the members of the Tobago House of Assembly, headed off by the Chief Administrator, to introduce herself and her team.
Good afternoon, Chairman. Good afternoon, members. My name is Bernadette Solomon Koroma, Chief Administrator of the Tobago House of Assembly. I will now hand over to my accounting officer, the Administrator Health, to introduce herself as well as the members of the TRHA team.
Good afternoon, Chair and members. I am Shelley Trim, the Administrator for the Division of Health, Wellness and Family Development. With me representing the TRHA this afternoon, we have Mr. Simon Wiltshire, the CEO of Tobago Regional Health Authority. We also have Mrs. Angel Second Ali, the General Manager of Corporate Services with responsibility for finance and procurement. We have Dr. Victor Wheeler. He's the Medical Chief of Staff for Scarborough General Hospital. We also have Mrs. Joan Solomon Ford, who is the Manager of Medical Imaging Services, and Mr. Jefferson Guy, the Manager of Biomedical Engineering.
Thank you very much, both to the Chief Administrator and the Administrator. And at this stage, what I would like to do is to invite the Chief Administrator to make brief opening comments if she wishes.
Good afternoon again, Chairman, Madam Chairman, and thank you for having us at this meeting to discuss issues concerning the diagnostic imaging services provided at the Tobago Regional Health Authority. These services include general X-ray, ultrasound, CT scan, MRI, and mammography, to name a few, and they are provided primarily at the Scarborough General Hospital and more recently at the Roxborough Hospital. Our main thrust, of course, at this time is dealing with the COVID-19 pandemic, and I would like to take this opportunity to thank all the healthcare workers and the frontline workers who put their lives at risk daily to keep us safe. Once again, thank you, Madam Chair.
Thank you, Chief Administrator. And then I will turn the mic to the Chief Executive Officer of the Tobago Regional Health Authority to make a brief opening statement. Mr. Wilshire.
Madam Chair, committee members, thank you for allowing us this opportunity to present to this committee. The Tobago Regional Health Authority, the TRHA, guided by its mission and vision, focuses on providing the highest quality of healthcare services to the clients in the Tobago landscape. The operations of the TRHA falls under the purview of the Tobago House of Assembly, the THA, which has a responsibility for health in Tobago under the 5th schedule. As the Chief Administrator said, the healthcare services are provided through the Scarborough General Hospital, located at Signal Hill, and 22 community-based healthcare facilities. The hospital has the main services, and ultrasound is now again being offered through the Roxborough facility. We are grateful for the opportunity to present to this committee and look forward to a productive session and the positive outcomes that can be derived from medical imaging services offered throughout Trinidad and Tobago. We look forward to the support and assistance that can be provided to us through this opportunity. Thank you.
Thank you very much. And I would just like to lead off our conversation in, as the CEO said, he spoke about your mission and vision, and to put it sort of in a context in that from the submission, I've seen that the last strategic plan of the TRHA was for the period 2014-2019. And I would like to ask if there has been a review of this plan and what achievements has the Regional Health Authority achieved the objectives of the plan?
Madam Chair, the last strategic plan, as you rightly indicated, was for the period 2014 to 2019. And in 2020, it was presently being reviewed by the current secretary at the time and administrator. However, with the recent change in events, we have had a change in the executive, at the executive level. And so a new strategic plan is currently being developed, and the administrator of the division should be able to speak more to that. So I'll hand over to Ms. Trim.
Thank you very much.
Thank you, Madam Chair. In addition to reviewing the new strategic plan, which would have covered from, well, 2020, it would have also been in conjunction with the TRHA board. The last board had been appointed in September 2020 for a period of 2 years. And in addition, they also had felt with the new onboarding of a CEO and key critical positions, such as the General Manager of Operations, the General Manager of Human Resource Management, they would have recently assumed duty in January 2022. So it was felt that it should be delayed until we have these key personnel on board to do a new strat plan.
So if I understand correctly, a review has not been done of the strat plan 2014 to 2019.
To determine key objectives, I do not have that information at hand, Madam Chair.
But so you have it, or it's just that you don't have it at hand?
I don't have it at hand. I'm sure there is a review.
So let me ask, when will that review be completed?
Now that we have the CEO and the key administrators with the GM and all of that. However, the last board resigned in December. So I anticipate the appointment of a new board so that everyone would have an input in the new strat plan.
Okay, so we're talking about the new strat plan.
Yes,
okay?
Manager.
I am asking about the old strat plan, if there has a review of it so that you know what objectives have been achieved. I understand you to tell me it's not at hand. So does it mean that it is something you can supply us, or it's not been done?
I can seek to supply that, Madam Chair. I have not seen it. I recently took over at this division, but I will seek to liaise with the CEO and my predecessor to confirm whether or not that can be provided.
Okay, thank you. Well, I have the CEO, I have the Chief Administrator here. So the Chief Administrator may be in a position to answer, because I understand the CEO is also new. Okay, so maybe the Chief Administrator is in a position to let us know if there has been a review of the strat plan, because your submission says that in the absence of a new one, you continue on that old one. So I want to know if there's been a review to know if it's relevant, if those objectives have been achieved and we just, sailing down the road. Yeah. What guides us?
Okay, Madam Chair. In 2020, I would have met with the then Secretary of the Division and the Administrator and the board, and there was a review taking place of the strat plan to look at it and to see how best they could tweak it to improve on the new one going forward. Now, events overtook us then, and that secretary was replaced by another secretary, and then we had an election again, and we now have a new executive on board with a new administrator who just started in December and a new CEO who started, I believe, in January. So because events overtook us, that review has been placed on hold at the time.
Okay, so thank you very much. So let me ask this. Because there has been no review, or a review has not been completed, would you be in a position at all to tell us about any key objectives which have been achieved throughout the period 2014 to 2019, 2020, which were objectives under the strat plan?
Madam Chair, because the key personnel have changed, we don't have that information at the time, but I know that there was a review taking place with the then secretary and the administrator at the time. And as the current administrator indicated, the board has changed as well. So the key persons who would have been involved in the review are not here presently. So we would not be able to say whether any objectives were achieved.
Okay, so let me ask this. I think it's quite clear from what you've said what your challenges may have been. Other than the challenges of the changing of the key personnel and the elections and so, could you identify if there were any other challenges involved in the review and the preparation of a new strat plan?
Well, I know that at the time the secretary was looking at data gathering, they thought it was important that they should have data in terms of the non-communicable diseases. So they were looking at building a database so that they could have that information on hand. And they were also looking at ways of improving customer service because there were a lot of complaints coming out from members of the public regarding that. There were also challenges with funding, which I believe still exist. Right, so off the top of my head, those are some of the things I know they were looking at.
Okay, and therefore, now that we have a CEO, now that we have a new administrator, we have a new chief administrator and so on, could you give us any idea of when a review is likely to be completed and when a new strat plan will be commissioned?
Okay, I will hand over to the accounting officer of the division who is currently liaising with the secretary on that to provide an update and response on that. Ms. Trim?
Thank you, Madam Chair. So I can commit that within a month, or let me not say a month or two, by the end of March 2022, because the CEO came on board on the 1st of February, there was a matrix that we can be guided by with respect to the key deliverables and whether or not we would have achieved that, as well as the new strat plan. I would liaise with the secretary to have a sense of when a new board can be appointed to give that firm commitment with respect to the new strat plan.
Okay, so thank you. So until you have a new board, the strat plan cannot be approved to be implemented.
Not entirely. It should form part of the board, should have some input.
All right. Okay, so that we will follow up with you all with communication with the progress of that. Certainly by March, if we could get some status with respect to that. Okay, so I thank you. I now will turn over the conversation to the members of the committee. I therefore will start off the conversation with Member Bodo. I'll ask you to ask any questions you would wish at this time. Member Bodo.
Thank you very much, Madam Chair. And again, welcome to the members of the TRHA and the THA. And just to start off by thanking all the staff, especially doctors and healthcare workers and so on, in what is a very challenging time for the COVID-19. And I know you have your special challenges in Tobago as well with regards to that. And to wish you well and to pledge continued support. Madam Chair, I just wanted to go back a little bit to the strat plan. I understand the context and what is happening right now with the new board awaiting appointment and so on. But there are three issues in the previous strat plan which caught my attention and which I think are relevant and which perhaps they merit some discussion or perhaps an update. And those are the objectives of medical tourism, telemedicine, and accreditation. Telemedicine is especially important in the times of COVID. But with regards to the medical tourism, I mean, one of the issues with medical tourism, of course, is that you must be able to provide urgent services. And I want to link that to one of the submissions which was sent with regards to the cardiac catheterization laboratory, the CAT lab. And if anyone in the TRHA or maybe in the THA, perhaps the chief administrator or the administrator or perhaps the CEO. And again, allow me to congratulate Mr. Wilshire on his recent appointment. I believe that you worked with at the SWRHSA when I was chairman. So it's good to see you in senior position in the TRHA and I wish you all the best. and to say a special hello to the Medical Chief of Staff, Dr. Victor Wheeler, my colleague as a gynecologist as well. So I just wanted to know whether we can get any sort of update on where we are with regards to the cardiac catheterization laboratory. And we're speaking about healthcare in Tobago. And of course, one of the issues is that if you have an urgent situation with a heart attack, for example, what happens to patients in Tobago? So I don't know if I can invite maybe the CEO or to give us an update on that. Through you, Madam Chair.
CEO.
Good afternoon, Dr. Badul, and thank you for your warm sentiments. I would like to actually pass that question to Dr. Wheeler in terms of the cardiac catheterization lab, in terms of the update. Dr. Wheeler?
Yes, good afternoon, Madam Chair, Dr. Bodo, thank you very much. Just as an update, the cardiac catheterization lab was functioning, and there was a service provider that was providing services, but the contract ended in 2015. Since that time, there have been several efforts to have a new service provider provide a service, because as you would understand, the expertise to operate the cath lab is very specialized staff, very specialized doctors and nurses. We have been unsuccessful. Several boards, several secretaries have made efforts to get a new provider. There were even attempts to have a foreign partner. That has not been successful. But in the interim, as you asked about heart attack, if a patient does require immediate attention and does have heart attack in Tobago, they are provided with emergency care at the hospital. And if any intervention is required, we actually have an arrangement with North Central RHA where we would transfer these patients by helicopter to get further intervention. For those patients who don't need emergency care but need elective care, we outsource. So for example, cardiac catheterization, if that is required, we outsource that provider in Trinidad where the RHA funds that service. If, however, the patients require more extensive cardiac intervention, we access the Ministry of Health program where the Ministry of Health has arrangement with providers in Trinidad to provide a service.
Thank you, Dr. Wheeler. So you're saying that there are two arrangements. There's the private arrangement, the TRHA, the collaborative arrangement with the NCRHA with the cath lab there. And then, so in terms of the funding for those who are outsourced to the Ministry of Health, is that paid for by the Ministry of Health in Trinidad?
Yes, the Ministry of Health has a program whereby persons who need certain procedures that they cannot afford, the ministry is able to provide that service for us, and we access it. When I talk about referring patients to North Central, for example, not necessarily for the cardiac cath lab service, but if they have a heart attack and need further treatment, we will send those patients to North Central RHA, Eric Williams Medical Sciences Complex.
All right. So just to be clear, the patients who are sent electively through the adult cardiac program of the Ministry of Health, that funding comes from the Ministry of Health, not from the TRHA.
Correct, from Ministry of Health.
Because I know those procedures can be quite expensive, 150,000 for one. So I was just wondering which budget that would come from. I would leave that, but I just wanted, there's a letter here specifically referring to the status for the cardiac cath lab. And I gleaned from the letter that that project was handed over back to the Ministry of Health. I don't know, Victor, maybe the CEO or maybe the administrator, Ms. Trim, could give us an update on that. This is a letter dated 28th October 2020. with regards to the status of the cath lab. Is anyone in a position to give us an update with regards to what is happening there?
So yes, so as I said, efforts were made to find another provider that were unsuccessful. And with the development of COVID in 2020, part of the space that the cath lab used, which was the recovery area, was converted into an ICU, and it actually now functions as the space where we provide COVID ICU care at Signal Hill. So until that ICU, COVID ICU is moved out, which we hope to happen within a month or so, even if we wanted to provide services in the cardiac cath lab, we would not be able to.
Okay, thank you, Madam Chair. I will allow other members at this point.
Okay, might I invite Member Webster Roy to ask any questions she wishes?
Thank you, Madam Chair, for the opportunity. Again, welcome to my fellow Tobagonians. Dr. Wheeler, you have mentioned that Tobagonians would have to be transferred by helicopter to access, I think it's the cath lab service. I'm not sure if I got that correctly, but I wanted to know what's the cost for that service to get them to Trinidad via helicopter?
Okay, the cost that we incur is actually the cost of the helicopter service itself. When the patient gets to Trinidad, the care continues at North Central RHA at no cost to Tobago.
But in terms of the helicopter transfer, that's the cost I wanted to find out.
Yes, I believe it's in the region of about 35 to 40,000. I will actually defer to Ms. Sakandali, who is the finance person, who will be able to give the exact figure, I hope.
Okay. Good afternoon, committee. The helicopter transfers are in the vicinity of $115,000 per transfer. The charge is usually per hour, and it's $60,000 approximately per hour. Right, so average transfer takes between 1 and 2 hours, so hence the cost of $115,000.
Wow. Okay. I know Dr. Wheeler mentioned that there have been attempts by previous secretaries and boards to have that type of service available, but they were struggling. Is there a commitment by the new executive, the new CEO, as well as the administrators, and to look into making that service available again?
If I may.
Go ahead, Ms. Trha.
No, I was just about to say that the service, as far as I'm aware, has been ongoing. However, we do have a heavy liability to settle.
Okay. What plans are there within the THA to assist you all in terms of covering that liability? Madam Chifa.
Yes, Madam Minister, through the chair, we are looking at coming up with a payment plan to address that outstanding liability, and hopefully it should be settled within the next 6 months. We intend to find that money to pay off that debt.
So within the next 6 months?
Yes, madam.
Okay, that's very good. Again, to the CEO. Congratulations on the appointment, as well as extend my congratulations to the new Chief of Staff for Roxborough Hospital. You would have mentioned that we now have ultrasound service available at the Roxborough Hospital. I wanted to know if we have plans to extend or expand the different types of imaging services at Roxborough, And if you have plans in place, what is the timeline? And what is the public education efforts of these residents of Roxborough and Tobago East would be aware that the different types of services are available at that facility?
There's a plan to operationalize the Roxborough Hospital in the next few months, but the plan to expand other types of services hasn't been developed to expand beyond there at this time. So we are going to communicate through the Tobago House of Assembly the rollout of services, and patients would be encouraged to use either the Scarborough General Hospital or the Roxborough Center. And like the situation in Trinidad, we look forward to the next few months to hopefully having 0 COVID cases in Tobago so that we can restart some of the services and some of the spaces that have been taken up by COVID expanded facilities and regain the normal operations of some of the services that have been reduced because of the distancing spaces and infection and redivision of resources that has caused.
Okay. In terms of the ultrasound, I guess the machine at Roxborough Hospital, is there a preventive maintenance schedule in place? And if there's one in place, can you describe it so the public to understand what the TRHA is doing to ensure that the equipment would stay up and running for a reasonably long time?
I have to comment based on my knowledge of commissioning process, having just toured the Roxborough facility for the first time last week. Having met Dr. Duke, who is the medical chief of staff in the Roxborough facility, the equipment there is all new. So what we do is we work with the vendors and we have a commissioning plan to bring those up to service ability. And there's a training of people there of how to use the equipment efficiently and effectively. And then there's an ongoing, usually preventive maintenance plan that's accompanied with the commissioning process for a period of time, so that the vendors will stay with us and make sure that the equipment is fully functional and stays that way. And the users are trained to use the equipment according to the standard operation procedures, which will then hopefully give good utilization and functionality and results, most importantly, for the foreseeable future, until the machine is past its depreciation cycle. And then we hope to, through the THA, get additional resources to then repair and replace. Thank you.
Thank you very much. I'm excited because I'm from Roxborough, so I'm hoping that when I visit, it will not be to use the service, just to see what is happening. Okay, congratulations.
Okay, so thank you. I just wanted to get 2 issues clarified. When the chief administrator spoke about the liability for the helicopter service, can we quantify that? Do we have an idea of what sum of money that is that you all are proposing to pay off in 6 months' time? So that if you can assist me with that.
The manager of services should have that figure. Ms. Angel Seconali.
Yes, thank you, Madam Administrator. As at the 31st of January 2022, our liability to National Helicopter was in the vicinity of $27 million. Right, so that's how much we owe them at present.
Thank you very much. So, Madam Chief Administrator, you're saying that you are going to be able to find $4 million at least per month over the next 6 months to pay off this $27 million.
Yes, Madam Chair, through the allocation that we receive on a quarterly basis, well, now we are receiving it bi-monthly, we will just have to find the money, move it around, and allocate the funding to pay off that debt.
Okay. All right, so that you would have got allocations already for fiscal 2022?
Yes, Madam Chair.
And have you been able to identify any funds out of the allocation you've got already for fiscal 2022 to make at least one of these payments?
I have some reports that I've looked at that we can't find the money, but I will defer to the administrator, who is the accounting officer there, to see what they have in place, because we were liaising with the Ministry of Finance concerning paying off that debt, and I know that they did come up with a payment plan as to how to liquidify the debt. So I will hand over to the accounting officer of the division to provide further additional information on how much has been liquidated so far.
Okay, and if the administrator in answering that will give us an idea of when she anticipates that this first payment is going to be made.
Yes, Ms. Trim.
Thank you, Madam Chair. That debt of $27 million as at January. I'm aware that since October 2021, additional funding has been made available to the TRHA. However, that is not the only debt that we have incurred. So an additional $4 million has been made available to the TRHA since October 2021, and they have been distributing that to clear down other debts. So some has been cleared off, and as Mrs. Second Ali would have indicated, an average of $115,000 is incurred every time we utilize this service. So it's a recurring debt. It's difficult to pay off entirely. However, I have reached out to the Division of Finance and the Economy so that we can look forward to reprioritizing and making additional funding available to the TRHA.
Well, I would like to say I'm really very confused by, what I'm hearing in terms of, I thought we were looking at not clearing off a continuous debt, but crystallizing that sum as of the 31st of January. And what I understood the chief administrators to say, that crystallized sum as the 31st of January is what you all intended to pay off in 6 months. But I believe the administrator, who's the accounting officer, is saying something else. That, so I would ask that between the administrator and the chief administrator, that you all sort of give the clarification to those questions in writing. And my second area for clarification is to the CEO. To ask, I heard you say that Roxborough will become fully operationalized in the next few months. So I wanted to ask what fully operationalized meant, and next few months, if you could sort of give me that in an idea of months. Next few months is what, June? Next few months is March. So if you could assist me.
Thank you, Madam Chair. I'm told that the plans are to have a beginning of service by the end of March. So by the start of April, we should have some services starting at the Roxborough Hospital. And
what are those? Can you itemize those? And if not, if we can get that in writing, please, what some of those services are, because I'm sure the people of Tobago would love to know.
Certainly, I'll have that sent to the committee. Thank you.
Okay, so that in writing, we will get an idea, a listing of the services to begin and as of when. That's my understanding.
Yes, Madam Chair.
Okay, thank you. Dr. Bodo?
Yes, thank you, Madam Chair. I just wanted to follow up on that $27 million expenditure, and if the answer cannot be given now, perhaps to follow in writing. I know you requested, Madam Chair, clarification on the process, but to ask how, over what period of time that was incurred, whether it is 2015, 2016, thereabouts, just to have an idea. Can that be answered now, or is that, do we have to, we'll get that in writing? I believe the administrator, Ms. Trim, might be directed to you.
Member Bodo, if I may defer to Mrs. Second Ali, who would have that information closer to hand.
Sure.
I cannot answer. I prefer to provide that answer in writing, but it would go back to around 2019, not 2015. Right,
Okay.
so it would be approximately 2019, but I could provide a listing of all the bills and the dates that comprises this debt.
Sure, thank you. Before we move on to some of the more details in the submission, I just wanted to go back, with your permission, Madam Chair, just to get an overall picture of how many people we are catering for the TRHA in terms of the residents, and we also know that you cater, of course, for a large visiting population. Is anybody in a position to say how many persons the TRHA caters for in terms of the healthcare needs? Is that figure available? So that will be both the population and visitors. I know during the COVID period it might have been restricted, but prior to that. CEO and administrator.
From a primary health care report in my possession, I have a population as of CSO 2011 is about 60,735. So I'd estimate population growth of about, say, 2 to 5,000 since then, and perhaps another 5,000 for the tourist population, visiting tourist population in and out, as a conservative estimate.
Sure, thank you. And I want to apologize for my video. There's some technical issues, but I also wanted to clarify in terms of the relationship and the working. Now, I know you have the Division of Health, Wellness, Family Development, and you have the TRHA, and they both provide healthcare services, and there is a budget because at the annual budget we would have approved, for as part of the THA allocation for the Division of Health, Wellness, and Family Development. But specifically in terms of for personal expenditure, hospitals and health centers and so on, there's a sum of about 10 million that is allocated annually, just over 10 million for personal expenditure. So I just wanted some clarification in terms of how it works. Some of the staff would be employed by the Division of Health, Wellness, Family Development, and some by the TRHA. Can you provide some light on that, CEO?
I would have to ask for clarification from the THA as well. But to my understanding, a lot of the staff are being hired by the TRHA. And what is happening is that we're going to have staff internally moved from some staff moved from the Scarborough General Hospital over to the Roxborough Hospital to affect the startup of services. I'm not aware of to what extent there's a mix of staff from THA versus TRHA.
All right. Would anybody be able to provide further light on that? Through you, Madam Chair.
Chair, through you, if I may undertake to provide the classification of staff that is paid under the hospital's vote, as well as any allowances, and maybe what would have been incurred for fiscal 2021. If I may provide that in writing, please.
Yeah, thank you. I will leave the point, but I just wanted to just make one further point, CEO, because we have that issue with the RHAs and the Ministry of Health in Trinidad, where you have this dichotomy and different reporting relationships and so on. So I was just wondering whether there were similar challenges in Tobago. But I can leave that. I just wanted to move on to
Dr. Bodo, if you permit me, I'd just like to ask you to hold your point a minute. Let me invite Member Rambarat to ask his questions, and then I'll return to you. He's been waiting a while. Thank you for being so patient, Member, and I'll return to you, Dr. Bodo. Thank you for being so courteous. Thank you. Member Rambarat.
Thank you, Madam Chair. I just want to ask two questions. Looking at the staffing breakdown for the TRHA, and I may be wrong, I'm counting their 1,914 positions on the establishment. And I noticed that there is about a 30% vacancy rate. So I wanted to ask, getting to the specific matter before us, which relates to availability of diagnostic imaging services. I wanted to ask you two questions. The first is, how does the almost 30% vacant positions impact the opportunity for the public to access diagnostic imaging services? First question. And going back to the use of the helicopter, I wanted to ask you, how often is the helicopter used? What is, looking at the last 5 years, what is the annual cost of the helicopter? And 3, on that issue,
So, Member Amran, may I ask, therefore, if you hold it so that we could get some responses to some of the questions that you're asking, so that midway somebody wouldn't have to ask in, what's the other question?
Right.
Okay, so thank you.
I'll stick to my first question, which is to ask the approximately 30% vacant positions, how does that affect the opportunity for the public to access the diagnostic imaging services in the TRHA?
Thank you, Mr. Rambarat. I'd like to, well, of course, any vacancy would limit the amount of the service that we can provide. But for a more detailed response, I'd like to defer that question to the manager of medical imaging. Perhaps could give you a more detailed response. Manager imaging.
Good afternoon, everyone. Good afternoon, Madam Chair. Vacant positions at the medical imaging department, we are looking at that. We have right now a limited number of radiologists. Interviews have been held, but no one has been appointed in the position. So I know there are actually vacant positions there. Although at this time I would like to also inform us that the structure that we are actually using now, that is in effect, may have, I think, one radiologist on the structure. However, that structure would have been 2012, but in the interim, the need has been identified for additional radiologists, and interviews have been held for consultants as well as consultant radiologists and registrar radiologists. So it means, therefore, that there are vacant positions. This is why the interviews are held. Radiographers.
Mr. Solomon Ford, just 1 minute, just before you go ahead. Could we have numbers? You know, this sort of generalization, I think, limits us in getting a full appreciation. So you have vacancies, you need additional. Can we have an idea of numbers, please?
Okay, recommendations were made for 2 registrar radiologists. Presently, we have 1 resident. And the 2 consultant radiologists, we have 1 part-time consultant radiologist. We have 1 house officer. I think recommendation is for us to have 3 house officers. Also, we have since had 3 vacant positions for radiographers. And recently, we have actually 2 persons have been assigned to that position, to those positions, sorry.
Madam Chair, if I may follow on, just to ask you, how would you say the absence of these persons affects the ability of the public to access diagnostic imaging services? And I'm just asking if it doesn't affect, if it severely affects how would you say it affects the public's ability to access diagnostic imaging services in the TRHA?
Hello? Is that question directed to Ms. Solomon?
Yes, it is. It follows
Yes,
the
it is.
information.
Okay. Right. What we have, our system at the hospital is a direct digital radiography system. It was the first to have entered the Caribbean. And from this, we have connectivity with the PAC system, Picture Archiving and Communication System. And from these two systems connectivity, we are able to forward images, that's electronic images, to the radiologist. So these can be done remotely. So although we may have one part-time radiologist in Trinidad, SMO, that doctor has been reporting remotely via teleradiography where images are transferred to the doctor. We have also one radiologist resident, and again, she would do reporting online as well as physically being present in the department. However, there is a need, as I said before, to have these numbers increased because this has been one of our challenges.
Oh, yeah, back to, okay, so I understand. Are the services to the public being affected by these vacant positions in relation to diagnostic imaging services?
I would say yes. More can be done if we have more people on board. But as I said, if we do not have we can fill the gap, some of it, a percentage of it with the teleradiography that is actually done now. But I think Dr. Wheeler might be able to help us with that question, the medical chief of staff, informing us of the vacant position for radiologists and what is being done to assist in filling the gaps.
So if I could just add to what Ms. Solomon is saying, we don't have challenges with emergency procedures. For example, emergency CT scan, emergency ultrasound scan, because these are done and reported on straight away. The challenge is for those persons who are not urgent and are patients who were referred from a health center or outpatient clinic. So the persons would have the procedure done, but we would have challenges in adequately doing timely reporting of the procedure. So this is where the current shortage of just one resident registrar and one part-time consultant affects us. And we have been trying to improve the staffing, but until we can get the additional staff, we would have challenges with persons who have non-urgent investigations to be reported on getting their reports.
Okay.
May I add something? May I add something to Dr. Wheeler's?
Yes, Ms. Solomon.
All right. In addition to the urgent cases being treated by the radiologist, we also have they're not hearing me.
We are hearing you very well. Okay, Member Amra, seems that we've lost Ms. Solomon Ford. So do you have another question you'd like to ask? If not, I'll invite Dr. Bodu.
Yeah,
but it has to be to somebody else.
Right, I believe it is to somebody else. I'm just going back to the helicopter issue. And I wanted to find out on average, what was the annual cost of the helicopter over the last 5 years? The first question. And the Chief Administrator made the point that in settling some liabilities, you've moved funds around, and I want to ask if the availability of diagnostic imaging services, that availability has been affected because funds are moved around to settle liabilities in other areas.
So I think this is a question for Mrs. Solomon Karuma.
Thank you, Madam Chair. Now, in terms of moving the funds around, that would lie with the administrator, who is the accounting officer of the division, and more importantly, I think Ms. Angel Second Ali, Manager of Corporate Services and Finance, should have that information. So I'll hand over to her, Ms. Second Ali.
Thank you. In respect of the average monthly transfers, the TRHA transfers on average 10 patients per month via the helicopter. We have seen some fluctuations in this service during that COVID period of 2021, but our projections, our projected spend per year for this service is in the vicinity of $13.5 million. Right, so that's the annual cost for the helicopter transfers. The second question I didn't get so clearly. If you could repeat the second question for me in terms of the moving the funds around.
Right, so thank you very much. So 13 million on an annual basis, and the liability seems to me to be accrued over more than 1 year. So I don't know what is the existing liability, but in moving funds from other votes to settle these liabilities for the helicopter service, are you impacting the availability of diagnostic imaging services in the TRHA?
Right, the liability to the National Helicopter Service is $27 million. But in respect of the TRHA's allocation, the TRHA is allocated funds under current transfers and subsidies. So we would receive a monthly release in block. And in conjunction with the Division of Health, it is determined how that money would be disaggregated and used to service our various debts. So in answering the question, I would say yes, because in times of limitations of funds, you may have to prioritize and choose to spend money in one way as against another way. And sometimes some services, we may have the plans to do a service in a particular way, but based on our limited capacity financially, we are not able to do the full extent of the services. So in answering your question, I would say yes, the moving around of funds would limit our capacity to do the full gamut of medical imaging services.
Thank you, Madam Chair.
Okay, so Dr. Bodo, I now revert to you.
Thank you, Madam Chair. Madam Chair, I just want to move on to seek some clarification on the response from the TRHA with regards to the Public Sector Investment Program 2021, which is on page 12 and 13 and 14 of this submission. But I want to just go straight to the page 14 with regards to the picture archiving and communication system, the PACS system, which I believe was spoken about by Ms. Solomon earlier. Now, I understand that is very important with regards, you may not have be able to have resident radiologists on the island and so on, or be able to afford them. And therefore, this is very important. But I see in your submission here that the PACS system, and I quote from the submission, the PACS system used for digitally transmitting X-ray images is at its end of life. The software version owned by the TRHA is no longer being supported by the developers. Therefore, a new version of the system has to be procured to facilitate continued use of the system. So I don't know whether Mr. Wiltshire or perhaps Ms. Trim might be in a position or Dr. Wheeler to give us an update on this. I see a sum of 1 million allocated. So can we get an update on that with regards to the PACS system?
Chair, if I may, through you, I would like to direct that question for an update to Mr. Guy, who's the manager of biomedical engineering, please.
Mr. Guy?
Hi. Good afternoon to the committee. Can I have the question repeated, please?
Sure, Mr. Guy, yes, thank you. So I'm referring to the submission which states that this, and we're talking about the PACS system, and the submission states that the software version owned by the TRHA is no longer being supported by the developers. Therefore, a new version of the system has to be procured to facilitate continued use of the system. And there's a sum of 1 million allocated. So there are two questions. One, the system spoken about by Ms. Solomon earlier, so is the old system still working? And secondly, if not, where we regards to the procurement of the new system?
Okay. What I cover is the medical imaging equipment, but we do have a PACS administrator who is unfortunately not a part of this session. We recently did do some investments to have our PACS system upgraded. We are currently still going through it. And I'm certain that the GM Finance we can be able to provide an update on that in a later document in writing if the committee so wishes. But we are currently going through that process of updating our PACS infrastructure in regards to software.
Thank you, Mr. Guy. And perhaps I can ask you to provide that update in writing to the committee.
Dr. Bodo,
may I add something, please?
Just 1 minute, Mrs. Solomon Ford. I think Dr. Bodo wanted to finish asking something. And when he's finished his statement, then I would call upon you. Dr. Bodo, yes.
Thank you, Madam Chair. So it's just there are three other issues here with regards to the development program. One refers to, on page 12, the MRI machine. So it's said here that the MRI machine failed during the COVID lockdown period and is in need of major repair works or replacement. And there's an allocation of 6 million. So I don't know if we can get an update on that. CEO Trha, I don't know how they administrate power. Ms. Trim?
May I just ask something? Ms. Trim, could you tell us the date of your assumption of duty?
The 23rd of December, 2021.
23rd of December, what year?
2021, Chair.
Thank you. Ms. Solomon Kuruma, could you tell us the date of your assumption of duty?
The 23rd of May, 2019.
2019. Ms. Second Ali, date of your assumption of duty?
I have acted in this position from March of 2020.
March of 2020?
Yes.
And how long have you been with the THRA?
I have been here for 23 years.
23 years, okay. Yeah. And Mr. Guy, your date of assumption of duty?
Madam Chair, I have been with the RHA since 2009.
Thank you. Okay, yes, Dr.
Yeah, so I was directing perhaps as the CEO with regards to an update on the MRI machine. I know this is a big ticket item and something very important and urgent. Can you provide an update as to where we are with the either repair works or replacement for the MRI?
I'd like to defer, thank you for the question. I'd like to defer that to Ms. Solomon, actually. Solomon?
Yeah, Mr. Wilshire, I think Mr. Guy would be the most appropriate person to address. We had a meeting yesterday, and I'm sure he has the information where he'll be able to give us the status of the MRI. Mr. Guy should be able to answer us.
Yes.
Mr. Guy.
Thank you, Ms. Solomon. So we are currently going through the process of repairing the machine. We have brought in the supplier, Biomedical Enterprises of Trha and Tobago, and they are currently attempting to bring our system back up to its functional state. We are having a couple of issues which would have resulted in our machine not being up in the time period we thought that we would have had it up back by the end of January. But we are currently meeting and discussing with the company to decide on the way forward because we have run into some amount of difficulties. We can provide some more information in a report to the CEO because we are still, as Ms. Solomon said, we had a meeting yesterday because we are still awaiting some more information from the manufacturer as well as the supplier. I would want to allow us to get that information first before a report is sent to the CEO, and then it can be provided to the committee.
Thank you, Mr. Guy. Just a follow-up again through you, CEO, as to how long this machine has been down, and how is there a waiting list? How many patients have been affected by this downtime? And the third question on that would be, what arrangements are currently in place for patients who require MRI? So the time it's been down, how many patients are waiting, and the arrangements in place to facilitate those patients who are waiting.
Thank you for your question. So the MRI would have gone down on June of the year 2020. Since then, we have been trying to get it back up. We had some serious issues with regards to the pandemic. At one period of time, so the machine is in a quench state, right? And as a result of that system being in the state, the magnet is warm as well too. It required, I should say, specialist engineers coming in from the manufacturing. There are only a few of them in the world. Unfortunately, because the pandemic was ravaging through Europe, they had limitations in allowing their engineers to travel, as well as our country also was in lockdown for a period. Once this lockdown was lifted and persons were allowed to be able to, foreigners were allowed to travel to the country, we then started the process of bringing in the engineers. That was basically the reason why it took some time to get the guys on site. But as of last year, let's say in October, November 2021, it is when the engineers would have been able to be on site and start doing their data collection. And by sometime in early December, we started the actual process of trying to get the system up and running.
Thank you, Mr. Guy. So we're looking at the MRI down for 18 months, and maybe I could direct this through the CEO to the medical director, because he would be feeling the pinch at the clinical end in terms of the time, the number of patients waiting during this time, and what arrangements are in place to have these patients have the MRI. Can we have an answer on that, please?
Yes, Dr. Bodo. So when the MRI went down, we had a functioning CT scan. So any investigations that require the MRI that the CT can do, the CT was used instead. However, for those procedures that require the MRI, we have an arrangement with provider in Trinidad where we would outsource that service to the provider, and the RHA would fund the cost of the MRI.
Can you, sorry.
Yeah, so even though we don't have a function MRI, patients who really needed to have an MRI done had it done by the private provider in Trinidad.
Can you provide perhaps in writing the costs that the RHA would have incurred over this period of time for the MRI. I just want to move on because you spoke about the CT scanner, but I see here as well that in the submission with regards to the CT scanner, it says that this unit has reached its end of life and must be replaced to ensure continued delivery of service. So 2 questions. Is the CT scanner still being used? And if not, what is the current situation with regards to replacement? Because it says here must be replaced rather than repaired.
So the CT scan is actually functioning at the moment. It did go down sometime last year and it was repaired. But I would probably ask Mr. Guy to give the more technical response regarding the end of life situation.
All right, thank you, Dr. Wheeler. So one of the things that we have an arrangement with our supplier is to inform us when the equipment has arrived or is arriving at its end of life state. So we were informed that the end of life for the equipment is coming up, and as such, we have started the process of looking into its replacement. But as Dr. Wheeler has noted, the machine continues to function and is functioning well, and we do not have a loss of service. We continue to provide CT scans at the Tobago Regional Health Authority.
Okay, just permit me, Dr. Bodo. 1 minute. Mr. Guy, I believe this submission is as of January 2021. Okay? We are a whole year later. So in 2021 January, we were being told the unit has reached the end of life. All right? I understand the arrangement you have with your supplier. So what would have been the date or the period or the month in what year would have been identified as the end of life?
Thank you for your question, Madam Chair. 1 second. Madam Chair, unfortunately, I don't have the actual date in front of me at this point in time, but it can be provided in writing through the CEO. But I believe it is by the end of this year or early next year.
Okay, thank you. And just for my clarification, the MRI machine is still not working.
Yes, Madam Chair.
Okay. Yes, Dr. Bodo.
Yes, thank you. So I just wanted to ask about the dialysis machines. It's on the same item on page 14 and the plans for expansion of dialysis. And of course, dialysis has become a very important factor in the COVID-19 treatment of certain patients and so on. So I don't know whether through you, CEO, either yourself or the medical chief of staff, can give us an update on the proposal to purchase 6 dialysis machines, with 2 of them going to the Roxborough Hospital. I know we spoke about the operationalization of the Roxborough Hospital. So what is the situation with regards to the dialysis machines? That's the first question. And the second, and I will end with that for the time being, Madam Chair. The second would be with regards to the resuscitator in the NICU unit. I know medical chief of staff, being an obstetrician himself, would be keen to have had that unit installed. So that's a resuscitator in NICU and theatre for $200,000. Can we have an update on dialysis and the resuscitator unit?
Dr. Wheeler, could you take that question, please?
Sure. Thank you. Right. So the dialysis machines were purchased. They were purchased and installed in the Roxborough Hospital and in the Scarborough Health Center. In fact, I must say at this point in time, for the past year or so, the Tobago Regional Health Authority has been able to provide hemodialysis to all the residents of Tobago that need dialysis. And we actually have spare capacity, which we offer to visitors from abroad who sometimes come to Tobago for holiday and need to be dialyzed for a week or so. So at this point in time, our capacity to dialyze patients with renal failure is actually quite adequate to cover all the residents of Tobago.
Thank you. And the resuscitator, Dr. Wheeler?
Yes, that was also provided.
All right. Thank you. I'm happy to hear that visitors can get dialysis. One of the little constraints I have before I retire to Tobago is the fact that if I get a heart attack in Tobago, I still have to be flown to Trinidad. So I'm hoping that in the very near future that will be corrected as well. Madam Chair, I will defer to my colleagues.
Thank you very much. So I will now call in this order Member Webster Roy, Member Mark, and then Member Backus. Member Webster Roy.
Thank you, Madam Chairman, for the opportunity. I must say I'm a bit troubled just listening to the discourse as a resident of Tobago. Some of the services that you have mentioned, we have to take people to Trinidad. I don't know if maybe I'm interpreting it wrong, but apart from the fact that we have to incur additional costs to airlift persons or for them to maybe get a plane ticket, it's the emotional cost as well as the physical cost because of the delay in service. I travel between both islands frequently, and I meet people often waiting to get on a flight, and flights now, because of the COVID pandemic, flights are not regular. And I meet persons with their big envelope with their, I think it's the X-ray or whatever in it, struggling to get on a flight. Why can't we fix it in Tobago so they don't have to go through that additional burden? That's one. And two, if it is that we don't necessarily have enough persons on the island, I'm not talking about equipment, I'm talking about persons to deliver the service, why haven't we considered maybe offering scholarships so that Tobagonians could train up and be ready to take up the opportunities that are available, because we say we have vacancies. I'm listening to you, and as an elected representative, as a Tobagonian, I'm getting very emotional. We have to do better. So what are the plans to ensure that services are available to Tobagonians on the island of Tobago? Two, are plans in place to consider offering scholarships somewhere from the THA level to Tobagonians so that they can pursue training to be able to deliver the services right here so that our fellow Tobagonians don't have to struggle so much. A constituent came to me recently. She was diagnosed with cancer. She has everything in place to go and get the treatment, but she's just waiting to get some report. I was only able to access that report after I wrote. So we have to do better. Thank you, Madam Chair.
I take that as a statement. Or do you want to address it to any particular person, Member Webster Roy? Your mic is off. Your Member Webster Roy?
I was addressing it to the chief, the CEO, to everybody. Whoever could answer me and give me some measure of comfort, I would like some answers, please.
Thank you for your sentiments and passionate statement. Thank you for your sentiments and passionate statements, Minister Ayana Webster Roy. We are doing our utmost to fix the services as far as we are able to. We have gotten a commitment recently from the THA to help us whenever there's a need for expedition of flights for patients. So we are going to be calling upon them to assist wherever there's a need to make that happen, given the limited flights we're having now. And I'll turn over to Dr. Wheeler, who will hopefully bring you some comfort in other aspects.
All right, so we have sent certain persons on scholarship to train in areas that we are deficient. But I should just say generally, with population of 60,000 on the island, it's actually not theoretically possible to provide all the possible care that someone coming to the RHA provides. Why we have the arrangement to take people to Trinidad at the RHA cost is that if there's a service that Tobago doesn't offer and that service is offered in Trinidad, we transport that patient to Trinidad, essentially to ensure that patients who come for care at the Tobago Regional Health Authority facilities are provided the best care possible with the facilities that we have. And what we don't have, we certainly ensure that we take them to a facility in Trinidad that it can be provided. But we do have persons on scholarship for one or two areas that we don't currently provide.
Okay, thank you, Member Mark. Might I invite you to join the conversation at this stage?
Yes, thank you, Madam. Are you seeing me?
No, we are not. We are hearing you, but we're not seeing you.
Well, I don't know why. I don't know why. I think the video is off. Okay.
Yeah, we're seeing you now.
Yeah, thank you very much, Madam Chair. Thank you. Madam Chair, I just want to follow up on a couple of areas for clarification through you. First of all, I would like to ask either the CEO or one of the officials whether they can provide this committee with, first of all, a submission, oral submission, and later on in writing, as to the current stock as it relates to medical equipment. And when we talk about the current stock, we are talking about all that has been provided to us that currently exists at the hospital in Scarborough under the control of the THRA. What is the current status, Madam Chair, with these equipment, whether it's the ultrasound, whether it is the MRI, whether it's the CT scan, and other areas like bone density equipment? What is the current status? Are these pieces of equipment functioning? And if they are not functioning, why have they not functioned? I read in a submission before me that most of these pieces of equipment apparently are not functioning, and most of the services have been outsourced. Now, that is a cause for alarm and concern for the health of the people of Tobago. So I would like someone, Madam Chair, to first of all provide us with a brief status report on all the critical pieces of equipment that have been outlined to us in their submission. And secondly, if these pieces of equipment are down, what are we doing to get them back up? And we talk about outsourcing, Madam Chair. We like to know what is it costing Tobago, and by extension, the Trinidad and Tobago, to have these pieces of equipment maintained. So that's the first round. If I can get some clarification, I would then ask you to allow me to go to my second question.
See you.
Mr. Guy can answer.
Hi. Thank you for the question, Director. I am concerned as to his question, however, because in our report, with regards to the medical imaging equipment, majority of the equipment are functional. So can I request respectively from the Director in terms of which equipment, other than the MRI, of course, which we would have said that we would have currently, been in discussion with the supplier, and we will submit it through the CEO, which equipment that is before him that he is he has some concerns about that is done, because I'm not certain I am. Is this not that he may be confused about with regards to our submission?
May I through the chair ask my colleague who is on the floor, before you, would you indicate in the case of X-ray, the MIR, the CT scan, the mammogram, the ultrasound, the BD, the BMD, and there's another one called fluoroscopy. I can't pronounce that name properly, but are these pieces of equipment all up and functioning? That is what I'm trying to clarify. Can you help us, Mr. Guide?
Yes. So the only machines that are currently non-functional at the TRHA is the MRI,
Right.
the bone densiometer machine. The bone densiometer machine would have also went down during the pandemic. However, the bone densiometer is one of those machines that actually Tobago is the only one that has it in a public facility. We're the only one that offer that service, and it is not utilized a lot. All right, it is something that we rarely use, and someone can speak more to that. But that is one of the reasons why that machine, we are currently discussing what is the future of that service coming from within a public facility. As I mentioned, that we are currently the only facility that does that at this time. And as I did say, that the MRI is something that we are currently working on. On our submission as well, to our updated submission, we would have noted that the cath lab is currently, the service is not being offered as well too. So as soon as we get a grip or understanding our way forward with regards to our management of our COVID ICU, or at our COVID ICU, then we will have a discussion as to how we're going to go forward with that piece of equipment. All right, but those are the only equipments that are currently non-functional. All right, we also have the ultrasounds. We recently replaced 2 of the older ultrasounds at our facility. They have reached their end of life period or useful life period, and as such, we are currently going through the process of border survey to have them removed entirely from the asset sheet of the organization. Right, but they are not in service.
Okay. All right. Well, I'm happy to hear that apart from those 2 areas that you have identified, most other pieces of equipment are up and functioning. So I'm very happy to hear this. What I would like to ask Mr. Guy, through the chair, can you provide us, first of all, with an understanding of the maintenance program for all of these very sensitive and expensive pieces of equipment at the Scarborough Hospital or under the control of the THRA? What is the maintenance preventative policy program? And do you have a document that guides you and the THRA as it relates to a policy on the maintenance, preventative maintenance of these sensitive pieces of equipment? Can you clarify for us?
Thank you for the question, Doctor. So yes, the TRHA, as with all the other RHAs, are in the process of adopting a national policy for maintenance plan. It is a national, it's a policy for the entire biomedical engineering, and within it, it does have a maintenance plan template. This should have been submitted or included, I should say, sorry, with our submission. However, if the director does not have a copy, what we can do is we can have the document resubmitted through the CEO. But yes, we are trying to adopt that. At the moment, we do have a service contract for all our medical imaging equipment. We have had set agreements in place from the time we moved into the Tobago Regional Hospital in 2012, and we continue to have said agreements. As the equipment age, what we have done is looked at increasing the frequency by which we have the suppliers on site to do checks. So we have moved from annual PMs to then annual and 6 months PMs. And then now for all our pieces of equipment, we have just renewed our service contract with the distributor of our medical imaging equipment at the Tobago Regional Hospital. And we have included 3 months checks. This is in keeping with, again, the age of the equipment and ensuring that we catch, the issues before they cause critical failure, right? So we do have something in place, but as I said, from a national standpoint, we are trying to also adopt the policy of that was submitted to the Ministry of Health for biomedical engineering.
May I also ask your procurement process? Are you part of, or is the THRA part of the general thrust as it relates to public procurement legislation, or is the THRA adopting, given its autonomy, its own approach to procurement and tendering of medical and biomedical equipment? Can you clear up that for us or clarify that for us?
Director, I would humbly request that that question be pushed through the GM of Finance. She might be able to speak more to that.
Right, good afternoon again. Yes, the TRHA is engaged in preparation for the full adoption of the Procurement Act. We would have started in the TRHA as far back as 2011 when we established our procurement department in terms of being prepared. And we are also guided by the RHA Act in terms of how we procure. So we continue to be guided by the Act, and we have exposed ourselves to the various trainings from the OPR office and also in conjunction with the Ministry of Health. The Ministry of Health has had several teams working collaboratively to adopt different standards and formulate handbooks, etc. So we have been part of that team, and we are currently in the process of also recruiting a head for our procurement department at the TRHA. So yes, we are becoming prepared for the full adoption of the procurement legislation.
Are you aware that according to the Minister of Finance, the act is supposed to be proclaimed and operationalized sometime by the end of March? And would that give you adequate time to recruit someone to head your procurement unit? Or would you be in some difficulty by the time this thing is proclaimed and fully operationalized?
Well, we anticipate that we'll have someone to head the department. We have actually scheduled the interviews for tomorrow. So we are hoping for a successful outcome from those interviews, that we'll be able to have that person on by the end of March. But if we don't, I, in my capacity as General Manager Corporate Services, provide the day-to-day and strategic management for the procurement unit. So if we do not get ahead, I would continue to provide that coverage until we can recruit someone suitable into the role.
Okay, thank you. And Madam Chair, if you'll allow me one final question before I pass over to another colleague. On the Roxborough Hospital, I wanted to ask the CEO, who said that by the end of March, come April, services, I don't know that on a comprehensive basis or on a partial basis, would be provided to the people of Tobago, particularly residing in that part of the island. I just wanted to ask the CEO if he can tell us whether it is going to be fully operationalized or partially operationalized, and therefore what kind of staffing would be required in both instances.
Thank you, Senator
Can I
Mark.
ask the CEO to clarify for me?
To the chair, thank you, Senator Mark, for your question. I understand it's going to be a partial opening with other services to come on as the time goes on. I just want to give further confidence that at the Scarborough General Hospital, there are a number of machines that offer the different services, so that even when one goes down, there may be another one that is still functional. And to come to your present question, the Roxborough Hospital going to have, in terms of digital imaging services, X-ray, CT, and ultrasound as well. So those will further back up the provision of services offered to Tobagonians and residents of the islands as terms of tourist visitors. So whether it's on the Roxborough Hospital or at the Scarborough Hospital, we should have some functionality of those services on the island.
Do you know what pieces of equipment have been laid out at this particular facility? Can you provide that in writing, or would you be able to help us, now?
Through the chair, I should be able to help you now. In the submission on my page 4, we have detailed the actual pieces of equipment, the services they provide, and their functionality in table 1, so that you actually can see we have a Simon's piece of equipment for Roxborough, which does X-ray and a CM, and that is functional. Siemens CT scanner, which is again in medical imaging, and that is also functional. GE X-ray, also in the medical imaging area, and that is functional. The Mindray ultrasound, again, medical imaging and functional. And finally, the another Mindray ultrasound in the A&E, and that is also functional. So we're going to have, apart from more than one equipment at the Scarborough General Hospital, we have at least one of each, and sometimes more than one in each in the Roxborough facility. So we can offer services of those 4 areas, 3-4 areas, to the people of Tobago in hopefully a seamless function. Thank you.
All right. Yeah, thank you, Madam Chair.
Member Barkas, thanks so much for being so patient. Might I invite you to join the conversation now?
Thank you, Madam Chair, and thank you again to all of the people from the TRA and the Tobago House of Assembly. Well, second time in a week, I'm actually feeling like I'm at home in Tobago. As we talk about the equipment and the issues that we've had with some pieces of equipment, one of the things that I think engineers like to do, Mr. Guy probably would appreciate this, is have they discovered any common thread, or is there any common thread as to why issues have been happening in terms of breakdown, not in terms of things stopping for routine maintenance, but in terms of what is causing, if there is any common thread, in terms of what is causing these things, these machines, not to be able to fulfill their function.
Hi, Yes. Good afternoon again. So one of the things that we would have struggled with in the beginning is a stable power supply to the Scarborough General. And this is in the beginning. So while as we have systems in place to deal with spikes, we would have struggled initially with having, low current supplies. And that would have done some damages to the X-ray machine, which over the lifetime of the X-ray machine, we saw the effects of it.
So this is an event where it is the environmentals or the network support servicing infrastructure was actually introducing issues in the functioning of the equipment itself. This obviously has been rectified, I would assume.
Yes. We have been able to rectify it a couple of years ago. Yeah.
And I know equipment on the leeward side of the windward side of the island as well. If you're talking about anywhere from Crown Point to Speyside, including your health centers in those areas, would also be subject to significant sea blast. Is that also a contributing factor to the things that are happening? The Roxborough Hospital may find itself under that type of effort, as will Signal here. Is that also happening to you? And is it affecting any other of your infrastructure that may be associated with your imaging?
Yes, sea blast is always an issue on the island. Managing our humidity as well too is also something that we also keep a keen eye on. Roxborough is new, but we have good staff up there who would continue to monitor the machine, continue to work with the suppliers to make sure that the checks are done on time, and that we keep an eye on the environmental conditions and what it is doing to our facility. One of the things that, and equipment, one of the things that we would have learned from in the previous facility at Scarborough General was to ensure that at Roxborough, that we have all of our medical equipment from the start on protective electrical systems, UPSs, in order to ensure that we don't have the issues that we would have had initially at the Scarborough General Hospital.
Thank you for that. Again, through you, Madam Chair, the policy that you have relative, I know you would have a policy relative and it will evolve over time relative to your support and how you're doing that. Does that policy include collaboration among the RHAs for things that you have in common that would include support contracts, vendors in common, so the training would be common, for example, where the equipment required is similar and fit for purpose? Do you do collaborative type procurement, etc.? Is that included as part of the strategy in your new policy or the policy that you have relative to those things?
Yes, thanks for the question. So as far as biomed is concerned, Tobago is one of the youngest departments. So over the years, we have definitely collaborated with the other biomeds in the other RHAs over the years, and we still continue to do so. And that is one of the reasons why we tend to reach out to one another, especially to get materials, spare parts in some cases as well to keep our equipment up and running. Just general advice. We do from time to time request support from our board, from our executives to send our technicians down to Trinidad to learn or to have a transfer of knowledge in specific areas. So yes, definitely it is something that we continue to do, and we will be continuing to do, over the next couple of years as well too. That is something that we will definitely continue to do with regards to collaboration with the other RHAs.
Again, Madam Chair, through you, the integration of the solutions that you have, I know you mentioned the PACs, I've seen in your submission, you have a health information management system, you have an asset management system, etc. Are these systems being integrated, and are you taking advantage and exploiting all of the modules that would make all your services actually become seamless and end-to-end? For example, your health information management system, I recognize it's called SELMA. Multiple modules within that particular system that could deal everything from patient care. And it can also integrate into your diagnostic imaging machines, so that it's not just that you use PACS to send things to your people who are reviewing them, but it also becomes part of the patient record, and it is done seamlessly. And those types of initiatives, basically the digitalization initiatives, are those things part of your plans, and are you actively pursuing them?
Thanks for the question. I really will not be able to talk much about Selma, but as you rightfully said, with regards to our asset management system, which we currently are using is TMA, Web TMA, the upgraded version. It's a modular type system. We are using a lot of the features, but there is so much more we can actually do with it. And I believe through the Ministry of Health and their plans going forward is to ensure that all the other RHs as well too is included as part of this Web TMA asset management national system. And the idea is to ensure that we become more and more competent in order to make full use of our asset management system. And as I mentioned, right now it's the Web TMA that we have here, but there's so much that we can do with it. But it's a continuing process. Right now we store all our static data. We can generate some reports. But there's so much of the software that we haven't even touched as yet, and we will be looking forward to working with the Ministry of Health as well too, to help support that thrust in fully utilizing our asset management system, a computerized management system, asset management system.
Thank you very much, Madam Chair. Thank you. I relinquish to other people.
Thank you. Very much, Member Bacchus. I just want to maybe change the focus a bit. I don't know if the CEO is in a position to answer this, but maybe the acting manager corporate may be in a position to assist. Now, in the submission, this is page 3, where you all spoke with respect to vacancies. And there's a high number of vacancies. In fact, if I understand the submission well, there are about 486 positions without bodies. Can we get from you all a breakdown of positions with respect to vacancies? One, and secondly, is the position the same in February 2022 with respect to vacancies as it was in January of 2021, which is the date of the submission?
Madam Chair, is the position from January of last year to this year would not be the same, because we have filled a number of vacant positions since then. But in respect of the breakdown of the vacancies, I think it would be best if we could provide that in writing to the committee.
Okay, so thank you very much, Ms. Second Ali. So if we could get a breakdown of the vacancies and those that have been filled and as of what date. Okay, and therefore, do you have an idea of the current vacancies in terms of numbers? What your current number of vacancies without bodies look like in terms of a number?
Chairman, I'm unable to give that figure also. So
yes.
I'll have to provide that in writing.
Okay, and might I ask, have you all been able to identify what is the reason for the high number of vacancies, the inability to recruit staff? Because somewhere in the submission, there was a statement that you all had held 2 rounds of interviews but hadn't been able to fill the position. So have you been able to analyze what really are the main factors of your inability to fill positions?
Madam Chair, if I may, the inability to fill positions is not unique to the Tobago Regional Health Authority. It's a challenge that we face throughout the Assembly because of the brain drain that we have. A lot of qualified Tobagonians do not come back to serve here because one, our compensation package tends to be low compared even with Trinidad. So it's a challenge on the island finding suitably qualified persons to take up senior positions, especially technical positions, and you find that we have to keep going out again to re-advertise because of the quality of the candidates that present themselves. So it is a challenge throughout the Assembly, throughout the island, and we try our best to extend the reach of the ad to Trinidad and to other places as well. But there's a cost when you recruit persons from overseas. So it is a challenge, but we try to, work with it as best we can.
Thank you, Mrs. Solomon Karuma. And that's what I was going to ask. If it's a challenge to recruit people at home, I see that. And you said it just now too, that you've extended your reach outside of the Twin Island Republic. I've seen you have advertised internationally and regionally. And therefore, I was wondering, doing that, what you would have considered would have been the extra additional factors to attract people regionally and internationally if you couldn't attract people at home?
We have to enhance the compensation package, and that is usually what happens. So if we find somebody who is suitable, of course, when you offer them the salary, they negotiate, and sometimes we have to provide not only an enhanced compensation package, but also accommodation with it as well in order to encourage them to come to Tobago.
Okay, and have you had any successes with that? Let's say in the last 2 years, have you had any successes? Well, 2 years because of the pandemic, but let's say from 2018, have you had any success with that?
Yes, Madam Chair, we have. Even our current CEO of the Tobago Tourism Agency was recruited from overseas. So we have had challenges, and we have overcome it by extending the reach and enhancing the compensation package. And as I indicated, sometimes you have to throw in accommodation as well in order to get them to come to Tobago.
Okay. So in health, have you had any success? Any recent success?
Well, we have had Dr. Nathaniel Duke returning home, and he also has other persons that he's encouraging to come and help assist at the Roxbow Hospital. So we are making some headway.
Okay, thank you very much. And then might I ask some questions about your internal controls? In terms of, I see in the submission, we've had a long explanation with respect to what happens with internal audit and the role internal audit plays in the TRHA. And I wanted to ask, when was the last internal audit done, and in respect of what departments?
Okay, I will ask the administrator, because I know the internal audit that we have residing in the THA, they would examine the Division of Health, but I do not think they reach down into the TRHA. They do the Division of Health, so maybe the administrator can cast some additional light on the last internal audit that was done there.
Thank you, Mrs. Karuma. Yes, the TRHA usually engages external auditors, I would ask Mrs. Ali if she can provide the last date of the last audit report, please.
Okay, so just before we go on, let me just ask this. On page 19 of the submission, what we were told is that to examine the systems in place at the TRHA to assure accountability and value for money with the use of public funds. The internal audit, you told me that you have 3 persons employed at the internal audit unit, and the breakdowns are internal auditor, 1 audit officer, 1 internal audit assistant. Okay? So in terms of that, do we have a function in internal audit department?
Chair, under the division, yes, we have some auditors assigned through the Office of the Chief Administrator to the division, yes.
But not to the Tobago Regional Health Authority?
No, Chair.
Okay. So that any auditing function is provided through the THA Division of Health and Wellness?
Yes, Chair.
Yes? Okay.
Chair,
Ms. Sakanali.
please. May I come in, please, Madam Chair?
Yes, Mr. Bishop.
We at the TRHA do have an internal audit department, so that our audit is an internal audit, and then we go externally through the THA and through external auditors to provide secondary audit services. And I have in my possession a report about the internal controls of the TRHA, and it was dated the 3rd of March, 2021.
Okay. And in terms of, was that report in respect of all aspects or just certain departments who were audited by internal audit? You know, what was the scope of that audit?
I would like to defer because I haven't gone through it in full detail, but I can resupply that information in writing to the committee subsequently.
Okay, and let me ask, and if you are not in a position, Mr. Wilshire, maybe Mrs. Second Ali might know, in terms of, has a charter for this year been set up by the internal audit unit of the TRHA?
If I could venture a response, the internal audit function of the TRHA reports through the CEO and into the audit committee of the board of directors. Therefore, at the start of every board term, the internal audit department would outline their plans, which would first start with a risk assessment being done. So a risk assessment is usually done by each department, and then through this risk assessment, the audit committee determines the areas of focus, right? So the internal audit would have done such an exercise when the board started in 2020, November, thereabout, and they would have started working on the different internal audits. I cannot speak for other areas, but I know in the finance area, the internal auditor would have looked at our budgeting policies and our system. The department looked at our accounts payable system, and they also would have looked at cash management over the last 12 months.
Okay, so it would have been in respect of that, this report of the 3rd of March, 2021 would speak to.
Yes, Chairman.
Okay, so would it follow then that in the absence of a board, there has been no charter of internal audits as yet planned for fiscal 2022?
That response, I am not certain in terms of what happens with the audit in the absence of a board. So I would defer to provide that response in writing from the internal auditor.
So let me ask this, and you might be able to assist Mrs. Angle second, because You've been there for 23 years, and I think what you told me is you assumed this post in March 2020. If I'm correct?
Yes.
So
correct.
in terms of what operates, your internal audit department will set out its charter, do its audit fieldwork, report its audit results, and so on. Is there a mechanism for these reports to be communicated, these reports, findings, and recommendations to be communicated to the departments? And if there is, how is compliance with the reports and recommendations? How has that been maintained up to 2021?
Right. In respect of work done by the internal audit department, at the completion of any audit, the internal auditor would share the findings and the findings of the audit with the respective department. The departments are then given a time frame in which to respond to the audit with recommendations, and that report is then sent to the board's audit committee, right? So the board audit committee has the monitoring function in terms of whether it be quarterly or every 6 months, having an updated response from the department in terms of the progress of the implementations of the recommendations from the audit.
Okay, thank you. And therefore, CEO, I'll give you an opportunity to provide with us in writing what it is that the internal audit department is currently engaged in, and whether the audit department is adequately staffed, because I don't know if the position remains that you still have one auditor. I think it was three persons, one internal auditor, one audit officer, and one internal audit assistant. But my recollection from reading the submission is that there were vacancies. And therefore, in terms of giving us an assessment with respect to the adequacy and plans for recruitment. All right. And the other question I would ask again, Mr. CEO, but to give you an opportunity to give us in writing. I don't get the impression that there is a monitoring and evaluation unit in the TRHA. I don't know if you could confirm that or whether my understanding is wrong.
Thank you, Madam Chair. From my short tour last week, I was introduced to the internal auditor and at least 2 members of her staff. So I'm not sure if her area is fully filled or whether there are vacancies or not. But as you recommended, I will communicate that to you and confirm that to you and the activities in writing subsequently. In terms of a monitoring and evaluation unit, I know that's an area in need of strengthening, but I believe that the primary care area has some responsibility for that, if I'm not mistaken. They do not so much monitoring and evaluation, but knowledge research and policy planning. So I think and monitoring and evaluation under health promotion, there is some monitoring and evaluation there, but I think there's a greater need for monitoring and evaluation and data gathering and statistics and so on, as patterned in another RHA, the Eastern RHA. They actually have a full health observatory unit, if I'm not mistaken. And that is something also to be strongly looked at to guide our evidence-based decision-making.
Okay, so we'll give you an opportunity to investigate that and let us know what your plans are for going forward to ensure that there is a monitoring and evaluation function within the TRHA. Now, there's an interesting statement that I found on page 23 of the submission, where they said that the service areas in the departments with the greater risk audited with greater frequency. There's fixed time audit frequency used for some auditable areas and a varying frequency for some. In the cases of the audit investigations for the higher risk areas, these are done annually. Now, with all due respect, this seems to me to be extremely generalized and vague, so that if we can get some details so that what areas are found to be generally greater risk areas, what is the greater frequency with which they are audited, what areas are done with fixed time audit frequency and what is this fixed time, this seems to be an extremely, vague statement that quite frankly can't assist us to assist you. Okay, so again, if that sort of follow-up could come to us in writing. Thank you. And the other area I wanted to look at is inventory control. And it appears to me that you all still do tagging. Is this a manual tagging process?
Ali, would you like to take that question, please?
I am unclear in terms of which area of the report, but we still do a manual stock card, if that is what you're referring to.
So you do a manual stock card. So let me ask, in terms of items of furniture, you have a manual stock card for that? Your inventory is done by entries into some ledger?
Right. When the inventory that was referred to here would be consumables like drugs and related materials and medical supplies, for instance. In terms of assets like furniture, what we would do is a tag. So yes, we have a asset register and we also have a tag that we will assign to each asset.
How regular then would this be reviewed in terms to ensure, because these are adhesive tags? Yes? Sorry. So to ensure that tags are still there, that the items are still there, that you correspond what is on your ledger with what is physically on the premises.
Right. Currently, we are engaged in an exercise to do just that, to reconcile our ledger to what is physically in each of the departments. And we expect that over the next between 3 to 6 months, we would have that exercise fully completed. And we are doing this because we have acknowledged that there are some areas that needs to be strengthened in terms of how we treat the fixed assets, right? So the authority is currently engaged in that exercise.
Okay, and you say in about the next 3 months you expect that exercise to be completed. But in addition to which, I see that you all have spoken about research technological solutions such as the radio frequency identification, right? Which will be implemented once funds are available. Do you have an idea? Because it didn't escape me the point made by the chief administrator with respect to funds coming on block and being able to move funds around and so on and so forth. I think we heard that earlier on in the discussion. So in terms of this RFID system, what is the likely time frame for its implementation?
This is something that we have on the books. I smile because it is one of those projects that keep being reprioritized in preference of others, because it is, we anticipate that it would be somewhat costly, and there are other priorities in terms of in terms of our hospital information system, and in terms of changing out old fleets of computers, etc. Even our firewalls, we have some issues there in terms of our internet. So I do not anticipate that this RFID project will take place in this financial year.
Okay, and therefore it means that you have to rely on your manual system and your tagging. Yes, and therefore the results of that review that is going to be completed in the 3 months, those results are extremely important to see if your systems are working. Okay, so we would like at the end of that to get some follow-up with respect to what your findings have disclosed.
Yes,
okay. And might I also ask, in terms of you were talking about the pharmaceuticals and your consumables, what system operates in terms of inventory control? And you know, what we don't want is that we don't know what is water, how much supply we have of water, and we use something else instead of water. So what systems do we have?
Right.
And how does that work, and how effective is it?
For the pharmacy system, so we have a pharmacy stores that is separate from our other stores, which comprise of food, medical, stationery, etc. For our pharmacy stores, we use the Hospital Management Information System, which is the SELMA. And for our other stores, we use GP, Dynamics GP, which is our Financial Information Management System. These systems are used in conjunction with, I would have mentioned the stock cards, for instance. The pharmacy department would use the register, the inventory register, that would assist in terms of knowing the reorder levels, for instance, for each stock item, and tracking expiration date for different batches so that we have proper rotations of stock, etc. So our systems, it's both computer-based and some manual at this point in time, but I think we do have pretty good management of stock. And we also, in addition to that, we use the basic spreadsheets in terms of tracking the high-risk items. So for instance, now that we are in the COVID pandemic, we would have a report that the medical stores, for instance, would produce at least 3 times every week. They would send this report to myself and the CEO to inform us of the stock levels for those high-risk items, right? So we use a mixture.
So in terms of the actual places where you have storage, how do you ensure that the facility itself is proper, adequate for the integrity of your stores?
And one of the things that we do, we would use our, well, we have our OSH department, and the OSH department would do regular rotations in terms of ensuring that how we store the items are appropriate. We don't have things on the floor, etc. And we also do we also maintain a regular pest control service, for instance, so that we use Rent-A-Kill, would come in and check for rats and lay down the different plates, etc. So that's some of the things that we do. Also, we would pay attention to the temperature, because some things are temperature sensitive, especially pharmaceuticals. So this is another area that we pay specific particular attention to in terms of ensuring the integrity.
So might I ask, when was the last OSH report given in terms of the integrity of your storage facilities, in terms of your air conditioning, your temperature, and those sorts of things that you've mentioned? When was the last report received?
The last OSH report that I would have received, we would have, in August of last year, we would have rented a new facility, again because of COVID, and us aiming to maintain a 3 to 6 months supply in all PPEs. Our current storage facility would have been up to its maximum in terms of those items. So we would have engaged a new facility. And in doing that, our USH department was invited to first be a part of the team in terms of examining the appropriateness of the building, etc. And so they were a part of that. And once the building was secured, the USH department would have done the respective reports to ensure that we would have outfitted the space properly. So we would have done like a gap analysis and charts and assign responsibilities to various officers. And we monitored that report until the facility was up and running. And then even then, USH would have continued their monitoring to ensure that all the gaps were closed and that the items were being stored appropriately and the building met all USH requirements. So that was the last report that I was.
That was the last report. So what about existing facilities? How frequently is that USH assessment done and reports generated? Because what you're telling me is you set up a facility, I think in August, we're now in February. Okay. When is another report expected? When is an inspection done? You know, if it's done every 2 months, every 6 months, is that generally complied with? Who looks at that? That's really what I'm trying to find out.
Okay, so our USH officer is located at the Tobago General Hospital, where most of our storage areas are. And that officer would do periodic checks. At least every 6 months, the USH officer will walk through the facility to ensure that we are in compliance with all the USH requirements. A report is only produced if the officer sees something that is inconsistent, right? So if we are in violation of any of the USH requirements, a report will be produced at that time. Well, sort of like a warning letter for us to close this gap.
Okay, so once there's nothing reported, the assumption is that everything is working, that your air conditioning levels are good, that you're free from rodents, etc., etc.
Correct.
All right, so there is no spot checking by the management to ensure that the assumptions are valid.
Well, the management, yes, there will be checks by management because management is on the ground every day. So once the management is aware of what the USH requirements are, and we would, it's a daily thing to be in compliance of those USH requirements. I could give a next example. The USH would have walked around June of last year and found that we had some boxes packed too close to a doorway. And we would have received a report on that. And so we worked, the warehouse would have come in as one of the solutions too, because that was part of the problem that we just was out of space. So we had the boxes packed in areas where they should not have been. And we would have worked to close that gap and to clear that doorway. So it's really, it's an everyday thing.
All right, so let me ask this then. You've said that in your submission, this is at page 26, that as far as quality control, having NIBDEC as the primary supplier of pharmaceuticals is a quality control measure, which assures the end user that the product meets required regulatory and quality standards, okay? So I wanted to inquire if you have incurred any inefficiencies with regard to the quality control of pharmaceuticals based on your reliance with NIBDEC.
I cannot, I don't know if Dr. Wheeler would be in a better position to answer, but the only incident I could think of within the last 12 months, we would have had some issues with some tubes that were provided for the dialysis unit. And those tubes came through NIPDEC C40. So at that time, what we would have done an incident report, and this report was channeled back to NIPDEC so that they could make the appropriate adjustments on their side for this particular items. But that is the only incident that I know of.
Dr. Wheeler, do you have anything to add to that?
Yes, we did get a supply of tubes to take blood from. That was not the appropriate size, not size and consistency, but same thing, we sent them back and they were replaced. We really have not had much problems at all.
Okay, so can I conclude that generally relying on NIPDEC as a sort of quality control mechanism has worked well?
Yes.
Yes? Okay. All right, I just wanted to ask two more questions on this area. In terms of your demand forecasting, I want to know if that has worked efficiently for your monitoring and tracking. If there have been errors, what sort of, degree of errors there has occurred, or if this is working well too.
In terms of the demand forecasting, we would have mentioned using the stock cards and also using our information systems to pull historic data. This has been working because it helps in terms of determining the usage over a period of time, and then we can adequately determine when to reorder based on the usage. Where we would have issues here would be if there is a spike in the usage, maybe as a result of something like COVID, and we would have to quickly reforecast in terms of our uses and reproject. But this method has worked fine for us so far.
Okay, and as far as your stock expiry or batch tracking method, where you've said that, which oftentimes proves problematic as assumptions made with respect to expiry dates do not always hold true. Can you say if you are investigating any alternatives or backups with respect to this mechanism? And if so, what?
Right, I think what this statement was saying is that the completely reliance on the first in, first out system of tracking has proven to be a little bit problematic in terms of expiration based on batches, because you may receive a batch at a later date with an earlier expiry date. So just relying on the first in, first out rotation is not the singular means by which we should track expiration date. So we have relied on not just the first in, first out, but the register that logs the expiration date of each batch is more what we rely on in terms of rotating stock based on the expiration dates.
Okay, so that is this actually being implemented and is it being complied with?
Yes, this is done by the pharmacy stores. Yes, correct.
All right, thank you. Might I now invite Member Bacchus to join the conversation?
Thank you, Madam Chair. And again, thanks to the committee and the panel. Just to follow up on where Chair left off, as it relates to inventory, checks I've done with other places, and I'm sure the CEO, having worked in other places, could attest to this. The issue of the expired drugs is something that shows up fairly often. When quantified in terms of its cost, it normally is significant. Has there been any study or any reports relative to what any period of time has been? And if so, is it available?
Through the chair, thank you, Member Bacchus. Through the chair, I'd like to defer that question to Mrs. Sekwandali. might have a better idea if that kind of financial analysis has been done.
Right. Right. I do not have that information at hand, so I would ask the committee if we can provide this report in writing.
Thank you. And the reason why I brought it up is actually you may find that if you look across things associated with inventory leakage, it may pay for the solutions that you need to address it. The other thing, and I'm sure there's an explanation for this, environmental control storage is not necessarily a spot check thing. So I'm not a medical doctor, I'll use a bad example maybe. Something that should be stored at 20 degrees, minus 20 degrees Celsius, put into a storage facility. The temperature of that facility has to be monitored almost in real time, should something happen to it. Yep. Electricity goes for a day and a half, remote storage in health centers for drugs and so on. How is this done and how is this monitored? Because it wouldn't be on a 6-month rotation. It wouldn't be on an OSH officer walking through. There has to be some mechanism by which we're able to manage the environmentals for example, something that is temperature control specific.
Through the chair, if I may, my understanding as a former general manager commissioning on projects, which had to do a lot with medical equipment and the equipping, those type of equipment that have those minus ultra low, minus 20, minus 4, and so on, usually come from a medical supply perspective with their inbuilt alarms, so that once those things are triggered and go below, some kind of alarm is sounded. And that will alert the users, the manager of the area, to then call biomedical people or so on to then provide some kind of redress, and or there could be an administrative procedure to then move things out of something that goes down and placed into a secondary cold or freezer compartment until the equipment is fixed. And we also have a liaison with the biomedical services. We always have an on-call person for just those kinds of emergencies after hours and on weekends and so on.
You're saying this is in your experience. Is this in place in the TRHA?
Let me defer that to perhaps Dr. Wheeler.
No, I wouldn't be able to provide that information at all.
Second, Ali, can you confirm? We have the engineering person, Mr. Guy.
Yes. Thanks for the question, CEO. Now, the refrigerations doesn't fall under me directly, but we do have a system in place where we would like to have all our refrigerators upgraded to have a remote monitoring system. So now we have our staff who are there on a daily basis. We also have the BMS staff who would do some monitoring out of the normal work hours, but we are moving towards using technology. There are some new refrigerators and freezers that are on the market that offer remote monitoring, and I believe that the pharmacy, I know for sure, is currently in the process of procuring some new refrigerators that offer that type of remote monitoring.
And thank you. And last from me, maybe again to you, CEO. When you look at the hybrid systems, for example, what you have in the inventory management, etc., it leads to areas in which, gray areas in which you may find that things either cannot be accounted for or are there but not necessarily logged. And so the integrations of those, the management of hybrid systems that have levels of technology, of advanced technology, levels of spreadsheets, Excel files, management of paper information becomes cumbersome and difficult. The transformation that you need to do that requires things across 3 phases. 3 phases would be, of course, the adjustments of the people and the changes for that. The new processes that you want to put in place to make sure that you transition away from it. And of course, the technology and the regulations to address that. Obviously, you're making those movements now. How are those areas being addressed or intended to be addressed based on how you plan your operations going forward? If you don't work across those spaces, you're probably not going to be successful. How are you setting that up, and how is that being managed? In what area is that being done? Or is it just spread out across everywhere? See, I was putting that to you possibly to start.
Through the chair, I think a good example of that would be the current Roxborough Hospital. And I'll ask for support from Mr. Guy in this, but we have dealt with that, I think, from a contract perspective, so that in the commissioning of new equipment, there will be an inbuilt process for perhaps training users to detect what the warnings is, how to use the equipment, how to tell if something's going wrong, and then a relationship with the vendor to then call them on a call service or repair service, and biomedical will get involved and so on. But the expert of this is Mr. Guy, so I'll turn that question over to him.
If I may, before you do, CEO, that speaks to the equipment side of it, but specifically to the people that have to work in there, the change that they have to do going from a paper system to analog, the processes that you have to change, whereby before you used to sign for this book to get this document, now maybe you have to scan it and so on. All of those changes to make, the way you describe Roxborough, you're describing Roxborough as a modern medical facility. The changes between that and what would have been an older type, more analog type facility. How is that management going? I understand the equipment piece. I think you have that well covered. What about the human pieces? What about the other pieces associated with that type of transition? How is that being done, given your ambitious time frame?
Sure, thank you. A lot of these equipment come with their own standard operating procedure manuals with them in terms of a step-by-step process as to how to use equipment. And the vendors have the clinical people to actually walk the people through the training aspect. So that is also done, and it's so well organized that sometimes you can just take their manufacturer's standard operating procedure and put it into a folder, and then that becomes the desk manual for the equipment. So I know from a lab perspective, because I have some experience in laboratory commissioning as well, that tends to be very much the operation for the training of the users. And then the final phase would be the rollout to the customers. So I think the point that Member Webster Roy was talking about, the sensitization for the community to say we're now offering this service at this location, come and experience, come and see and get your health checks done. Because apart from the health emergencies, the General Manager of Primary Care would very much like to say, have me say, Dr. Roxanne Mitchell, we want people to be healthier, not only to come to us in an emergency perspective, but to know your numbers. Dr. The Secretary for Health has a big program on that we would perhaps need to get back to, and we get better, lower numbers in the COVID pandemic, to get people to know their numbers, to come to the health centers, the hospitals, and so on in non-emergency times, to get their health checks done, to know what the statistics are, and then to use and come and see for themselves, perhaps, through those experiences, the quality of healthcare that the Tobago Regional Health Authority is offering to the Tobago residents and the nationals. Thank you. Mr. Guy, anything you'd like to add?
Not at this time, CEO, but I do understand that the director may have been also talking about change management with regards to that culture shift from a paper-based to a technological-based system.
Yeah, you're absolutely right, Mr. Guy, and that is something that you must cater for as you move and your transitions. So I expect, and I guess, CEO, what you're saying is, some of this is formally put together in the technical pieces that you have. Some of it is stuff you're going to have to do on your own. And that is the HR components that you have to manage with that. Please ensure that as you go forward, you identify where that is. And if you haven't, make sure that it is so. And in any of the reporting that you're doing with us, might I ask that you provide an update as to how that is going, because it may serve as a benchmark for the same types of transitions that have to happen in other places. So, you know, it's an ask as you go through your process, because I recognize the aggressive time frame you have. You would be able to capture a lot of that information. So in your reporting for other things that you're providing to the committee, or when we return in 3 months or 4 months' time, please include a report on that aspect of it in your submission, please. Through you, of course, Chair. Thank you.
Thank you very much, Member Marcus. Okay, so I really wanted to touch a bit on the Sustainable Development Goal 3, good health and well-being. But having regard to the responses thus far, I think that sort of interrogation may be a bit challenged, because based on your submission, what we were told is that since your strategic plan preceded Sustainable Development Goals, it wasn't focused on the Sustainable Development Goals, and particularly Sustainable Development Goal 3, which is good health and well-being. And this matrix, your, what you call it, the planning matrix, was really designed to ensure that your strategic objectives were aligned with the Sustainable Development Goals. From my understanding of this discussion, the review and analysis on achievements and objectives of the matrix has not been embarked upon or completed. And therefore, CEO, it means that this exercise becomes more critical, having regard to the fact that we just have 8 years to 2030, and all health institutions have reported sort of slippages because of refocuses on COVID, the fight against COVID-19 pandemic. So basically, I would ask for us to get in writing a report based on the programs which were instituted to ensure that your strategic objectives were in alignment with Sustainable Development Goal, Sustainable Development Goal 3. For instance, your focus on reducing maternal mortality, and you know, your focus on the NCDs, and additionally, you know, ensuring universal health coverage, so that if we can get in writing and we'd send the specific questions, you know, how your objectives and your plans to achieve Sustainable Development Goal 3, how that has been impacted by COVID-19, and what are going to be your realigned plans to ensure that these objectives are achieved by 2030. And I don't know if anybody is in a position to let us know, like for instance, you spoke about your challenges, and some of the challenges in achieving your Sustainable Development Goal 3, and I'm at page 40 of your submissions. You referred to issues with pregnant women and late booking for their pregnancies and that sort of thing. And your response was increased collaboration with the Department of Obstetrics and Gynecology and Primary Care Services. So has there been can anybody at this stage say if that has been successful in bridging the gap between what your objective was and the challenges?
I'd like to refer that to Dr. Wheeler.
Right. Good afternoon, Madam Chair. Well, we have in fact improved collaboration with primary care services, primarily between the obstetricians at the hospital and the district health visitors who provide antenatal services to all the pregnant women who come to the health center. COVID did have an impact on our ability to provide outpatient services, because from the beginning of December to just about 2 weeks ago, we had to close our antenatal clinics, outpatient clinics at the hospital. But what we did instead, we engaged in telemedicine via telephone, whereby we phoned the patients on a regular basis, and through a brief history identified which patients needed to come into the hospital. But over the past few years, the obstetric department of the Scarborough General Hospital, like all other departments, maternity departments in Trinidad and Tobago, have actually seen a significant decrease in maternal mortality. And you might have heard that last year, we actually surpassed our 2030 development goals for infant mortality by having the lowest infant mortality rates this country has ever had. So even though COVID did have some negative effect on our being able to see patients and persons in the clinic, we mitigated this by telephone consultations as part of our introduction of telemedicine to at least maintain contact with those patients, so that even though the care was not ideal in terms of physical assessments, this was for a period of about 5 to 6 weeks. We were able to continue to offer some level of obstetric care for them.
Okay, thank you, Dr. Wheeler. I will now invite Dr. Bodo. I believe you wanted to join the conversation.
Thank
Dr.
you.
Bodo,
Thank you.
yes.
Thank you, Madam Chair. Just to commend Dr. Wheeler in his capacity as both Medical Chief of Staff and a very experienced obstetrician gynecologist, and a very humble young man who has been at the forefront of this challenge to decrease maternal mortality. I had the pleasure of him serving on a committee in 2012, 2013, thereabouts, to address this whole issue of maternal mortality. I think in his capacity as an independent senator as well at that time. And I'm happy that he has continued to do what is required for the pregnant women of Tobago, and to urge him and to encourage them to continue the good work. Just by way of comment, Madam Chair, thank you.
Thank you very much. And I just want to ask one question, and maybe the General Manager, Corporate Services might be able to assist. On page 8 of your submission, where you had indicated, this is in terms of the TRHA response to COVID-19, and you had indicated for October 2020 to December 2020, you had spent a certain amount of money on COVID. What I wanted to find out is in the Auditor General's report, I believe there was excess expenditure in the period before. And I'm wondering, in 2021, there was an excess expenditure. And I'm wondering if that was used to wipe out the debt, or your over expense on COVID-19.
Chairman, I'm not totally aware in terms of the excess that the Auditor General would have alluded to in her report.
Yeah.
What I can say is that the TRHA was extended funds through the Division of Health and Family Development at the time to fund our COVID expenditure for 2020 and 2021. Right, so the debt that we had in relation to COVID was funded through supplemental releases for those years.
Okay, so that what the Auditor General had said, and this is as of the 30th of September 2020, 20, that there was an excess expenditure of about 2.5 million. Okay, so what I was trying to find out is whether, and maybe that's what you've explained to me, whether that was met by special funding or whether out of your allocation for 2021, your funds would have been reallocated to meet that debt.
And in terms of whatever we do not cover by the supplemental funding that was extended for COVID, we would cover those excess funds, excess expenditure by our regular releases, right? So it would be covered by either of those lines of funding.
Okay. All right. So what we'll do is we'll refer you to the statement made by the Auditor General and, you know, allow you an opportunity to give us a little more specific response in terms of that finding. Okay. Any other members willing to ask any other questions at this stage? Dr. Bodo, Mr. Bacchus?
No, I'm okay, Madam Chair.
Yeah. Okay, so if that is the case, I'm going to bring the discussion to a close at this time. There are a number of questions that we will send in writing to the CEO and the Chief Administrator to give you all an opportunity, particularly to you, Mr. CEO. I mean, just having come on board, today's what? Today's the 9th, so 8 days ago.
Right.
Okay, but I thank you for coming to lend whatever assistance you could to the committee. I want to thank also the Chief Administrator, the Administrator, also in terms of the Chief Medical Officer of Staff and all the other representatives. I want to thank you for coming and helping us to understand how the Tobago Regional Health Authority works, the challenges that you'll experience, and we'll continue the conversation in writing. I now bring this part of the committee meeting, the public hearing, to a close. I want to thank the members of the listening public who stayed with us and the members of the media. I thank you. Pleasant afternoon.
Thank you, Madam Chair.
Thank you.
All right. Take care.
Thank you. Thank you.
All right, thank you, ma'am.